Welcome to another day with your fertility specialist. My name is Nasha Miracle, and I'll be your host for today. And with me on set is a great personality, a consultant gynecologist, and her name is Dr. Jane. Welcome, ma'am.
Thank you very much.
Welcome. So, I want to use this time to appreciate our online communities. Thank you so much for always liking, commenting, and sharing our links. Thank you so much. Today, I want you guys to please like, subscribe, follow, and share with your friends, families, sisters, and everyone around you. Ma, so most times when I will hear people, talk about their period being missing for like 1 week, 2 weeks, and a month or two or three like that, and it happens with young girls, like single girls, mothers, or even older women, and it really get me confused. I want to know, like, what really do you guys mean when you say a period is irregular?
All right, thank you very much. Well, irregular periods. It's a good thing we are discussing this important topic in the month. We always celebrate menstrual hygiene. And irregular period is a very broad term. It encompasses a lot of terminologies. What is irregular to A is different from what is regular to B. Yes, so but even though before we even break it down, there is a limit of irregularity in menstrual cycles that is normal. So that we get that clear. So irregular periods can be from infrequent periods. It's a form of irregularity in your period. So like some people have less than 8 cycles in a year, or we have too frequent periods where your periods are coming less than 21 days.
Wow.
We also have people that have very heavy periods that sometimes lead to hospitalization. We have people that have very scanty periods. We have people that have very painful periods
Wow.
and all of that. So all of these things are a broad term to discuss or to describe what is irregular at different points in times. Of course, this is a topic that borders around teenagers,
Yes, ma'am.
reproductive age women,
Mm-hmm.
media, and also even older women and even menopause, people that are heading towards menopause. It cuts across broad.
Okay. Okay, ma. So, what variation in menstrual cycle lengths are considered regular, ma?
Okay, so menstrual cycle length. Any menstrual cycle within 21 to 35 days is assumed to be normal. So you have a period every 24 days is fine. You
Okay.
have your period every 32 to 33 days is fine. So you don't have to be bothered. Most importantly, we should note that the menstrual cycle will vary in dates.
Okay.
Reason is that there are no calendars in our bodies. So the
Yes.
body just works with the biological clock. So
Oh,
it means that you can have your period on 28th day. Remember, the next month might have 31 days,
yes.
and it might come on the 27th or 26th day. So long as it spreads across 21 to 35 days, is
That's
perfect.
that's okay. Okay. So, what are the common causes of irregular period?
Ah, irregular periods can be a whole lot, from very simple daily activities that we are not even things that we don't think are very serious,
Mm-hmm.
to very serious things that require treatment, hospitalization, and all. So, for instance, we have young people with eating disorders where
Okay.
they have these people that they have eating disorders, they tend to lose a lot more weight than they should. So any drastic weight loss can cause menstrual irregularity because there are some hormones that respond to that.
Okay.
Then we also have drastic weight gain can cause
Oh,
that. Stressors
that's
can, so when you are
interesting.
stressed, you can have irregular period.
Okay.
Then commonly we can have some challenges with your hormones. So a lot of times you hear people talk about hormonal imbalance, but a lot of things can cause that. So you can have commonly what we call the polycystic ovary, the commonest cause of irregular periods in young people. Then you also have some disorders. Well, for lack of a simpler word, we call them thyroid disorders.
Okay.
Yes. Then some other metabolic conditions, like some people you see them having breast milk discharge, when they're not nursing mothers, all
Yes.
those things can also, that is called, can cause irregularity in your period. Then
Okay.
down to structural or things that can affect your reproductive system, like people that have fibroids that are growing, that can make them have very heavy period,
Yes.
painful periods. We also have some other abnormal overgrowth, what we call polyps.
Oh.
We also have people that can have cancer of the mouth of the womb, what the convention calls cervix, and other
Okay.
cancers can cause abnormal period and all of that. So for every cause of abnormal period, there's
Yes.
a particular method of treatment or what advice can be offered to help improve that
Okay.
condition.
So I've heard people talk about missing their period or not seeing their period and then saying that, oh, you have PCOS or you have hormonal imbalance. Is there any link between that, the irregular period, and PCOS or
Yes,
other conditions?
PCOS is, as we say, polycystic ovaries,
Yes.
is a condition where women or young people or people develop cysts within the ovary
Okay.
and is a commonest cause of irregular period. In fact, when you see a young lady with infrequent periods, you hear them say, I have not seen my period for 2 months, and the period comes after the third month or
Yes.
something like that. That is the commonest cause of irregular period. And what it does, the condition makes them have a lot of male hormones. And the
Okay.
male hormones um exaggerate some. You see them, some of them will now have hair on their chest, hair on their
Yes.
chin, and all of that.
Yes.
Those are typical things. And when you do a scan, you can see those cysts, those abnormal collection of, it look like, see, when we say cyst, it's just like a space with something that looks like collection of water on ultrasound.
Wow.
So most of them will have those typical picture, and that is almost the commonest you see in young people.
Okay, so when somebody say they have irregular period, we are always pointing at PCOS.
No, not always.
Okay.
There, that's why that's why I said irregular period. What is irregular? Causing irregular periods for client A could be different from what's
From
causing for
client
client B.
B, yes,
So
yes.
your history or how I discuss the communication I have with you will determine our direction of diagnosis and possibility of treatment, and maybe what we now say is the cause of your own.
Okay. So you mentioned earlier that some people usually have heavy periods and some people scanty, right? So I wanted to know, at what point does someone seek medical advice when they are having either scanty or heavy period?
In fact, so from our early our discussion so
Yes,
far, you
ma'am.
see that scanty and heavy periods already are forms. They are all forms of irregular periods.
Yes.
It means that you must seek help. So
Okay.
when you see periods very heavy, becoming very painful, or you see people start to see blood after they had stopped menstruating, and all of that. So the different variations we have talked about. So for someone that's had regular period all along, suddenly the period stops.
Stops,
So your
yes.
body is trying to tell you something, and I think you should listen and probably see your gynecologist.
Oh, wow. So hope you're listening and you're learning. So now how can someone track their period? How can you track it, or what best method can you use to track your period?
Well, to track period, we thank God for technology.
I mean,
I think these our apps are doing amazing.
they are.
So you see, you can track your period on the apps. We have a lot of them, and the good thing with them is that once you input your details correctly,
Yes.
you can just have a dashboard where it shows you your cycle length, how you have gone through the month, through the year, and all of that, and that gives you yourself, okay, I have been menstruating within the normal menstrual
Yes.
cycle, things have been fine.
Yes.
Then another method of tracking your period, well, the apps are doing a good job, but yes, when the apps were not there, we could use our calendars.
Calendar.
But what it
Okay.
means is that you have to take note of that,
Okay.
and you might not get the reminders or the alerts or the alarms that your trackers would give you.
Okay.
Basically, those are the things, except but within the period, there are some things that can tell you I'm ovulating. That guides you, like
Yes.
what they call about body temperature. You can have ovulation kits. Those things guide you to tell you
Wow.
you're in the middle of your cycle. But commonly, you track your period cycle length based on I think preferably the apps, they do a great job. But for those without maybe Androids and all of that, you
Yes.
could use the calendar.
Okay, so I think for a lot of population, they have access to the app. So I advise that you go get your apps and track your period. So you mentioned some hormones earlier, not really mentioned the hormones, but you talked about the male hormones that affects the period. So I wanted to know what are some of these hormones and how can hormonal imbalance cause the irregular period.
Well, the common hormones involved in management of in menstrual cycle. Well, commonly, I think almost any woman that has entered the hospital and said they told me I have hormonal imbalance must have
Yes.
heard of what we call FSH. Well, I will
What's
explain.
that, ma?
Sounds very big. FSH and LH, but well,
Okay.
they are just the basic hormones. For lack of a word to break it down, it says follicle stimulating hormone.
Okay.
So when we say FSH, it's follicle stimulating. So it just means the hormone in the first half of that helps to stimulate the growth of your follicles. That's
Oh,
the what we call eggs in quotes.
okay.
Yes. While the LH, luteinizing hormone, is seen commonly in the second part of
Okay.
the period, and that LH helps as it's the as the follicles are developing, they are forming more of what we call estrogens, common female hormone, just like we have
Okay.
androgens for the men
Yeah.
and all of that. Those
Wow.
hormones are responsible. So when you have high values or imbalance ratios in those two, it can affect. Then we also have a hormone that is produced from the brain.
Okay.
Well, I'm not. It might be difficult to just list it out, but that
Yes.
hormone signals the body is responsible for the release of what these two common hormones I've mentioned.
Okay.
So there's a way it just responds. So for people that have this weight loss kind of irregular periods,
Yes.
excess people
Weight
that have
loss.
eating disorders, weight
Okay.
gain and all of that,
Yes.
they fall in that type. When we say hypothalamic problem, hypothalamic is just a part of the brain that produces
Oh.
those hormones. Yes,
Okay.
and it now sends it down and it's produced. So those hormones, any variation in them, anything that will make those hormones not to be produced.
Mm.
So the what we well the hormone from the hypothalamus then can
Okay.
affect your cycle. So those things are medical jargons. Unfortunately, I don't have a word to break
Okay.
them down.
All right. So there are times that a girl will say, I've been working the whole week and my period just came because I've been stressed. So I wanted to know, does stress or other, underlying medical condition have like,
Well, everybody's life is stressed already. So so else but significant stress can
Okay.
also affect your period.
Wow.
Yes, so I'll give you an example. When we were
Okay.
in medical school,
Yes.
after every major exam, I'll have one or two of my friends that will complain, I haven't seen my period. You know why? Significant weight loss,
Oh,
excess
too
stress,
much reading.
excess stress, and too much reading. So you see that stress is an important cause because there's another hormone that it produces called stress hormone, cortisol. That has a way of altering these hormones we have discussed earlier, and it can affect your period significantly. Yeah,
Okay.
so excess stress because someone will say, but I see a lot of people even more facing more stress than me. Yes,
Yes.
bodies are different.
Mm,
What someone can handle might be different from what someone else should be
okay.
can handle.
So, being a gynecologist, a consultant gynecologist at that,
Uh-huh.
um, does irregular period has a link with infertility? And if it does, how?
Yes, irregular periods. In fact, it is said that when someone has regular periods, it's a sign that the person is ovulating.
Okay.
So when your periods are regular, you are likely ovulating.
Okay.
So it means that if you are ovulating, ovulation is the sign is the only way that you can tell a woman is pregnant. So
Okay.
for every woman who has conceived spontaneously,
Yes.
the woman would have ovulated.
Ma, what is
But people,
spontaneously?
okay, so a woman that has gotten pregnant from natural
Oh, okay.
method.
Okay. Okay.
So that is you know that she ovulated. So ovulation is only when you ovulate you can get pregnant.
Okay.
So regular periods is a marker of ovulation. So it means if your periods are irregular, you likely not ovulate, it means that infertility, you might have difficulties conceiving because you cannot track your period. You
Okay.
cannot say when you're ovulating or when you're not ovulating, and that might be a significant cause of distress
Okay.
for the clients.
Not to deviate from our topic, but so a woman that sees her period every month, I heard someone say that doesn't mean that she's ovulating.
Yes.
So how does that happen?
Yes, a whole lot. In fact, this PCO we just mentioned,
Oh, okay.
polycystic ovaries, is a common cause of an ovulation. So when we say ovulation, when we put an after it, an
Yes.
ovulation, it means you are not ovulating. And
Okay.
that is one of the commonest cause. So someone can actually menstruate regularly, but it's not very common. So if I have 90 women see periods regularly or 100 women, out of that 100, 90 of them might be telling my periods are irregular and she's pregnant. I
Wow.
haven't seen my period in 3 months. You just put a probe and you see that she's so
Wow.
you don't just start saying it's hormones and all of that.
Yes, yes,
You need
yes.
to interact with the client or what the client had told you.
Yes.
You can now examine her too. Some things can be found on examination. Examination just means looking at the different body parts, trying to identify whether there's an abnormality
Yes.
or not. Do maybe other investigations, either what we call imaging or
Okay.
work. So
Wow.
imaging is where we do ultrasound. We now check for those hormones that we had discussed earlier, and also the
Yes.
hormones that will make them have abnormal breast milk discharge.
Yes.
Then even the thyroid we mentioned. A lot of investigations will go into the results, and we're able to
See
like
where
on
it's come.
ultrasound. You can see the polycystic ovaries, or you can
Okay.
see fibroids, you can see abnormal growth in the uterus. So every
Every
investigation
investigation
has
has
something
something
is
is
going
going
to
to
and
point.
that would guide your treatment afterwards.
Okay. So after taking your treatment, your
Examination and all.
examination and
Do
all,
you
do
have
you have like medication
medication
or
or
regular period?
you said you have medication. No, you're so sorry.
I don't know. I just want to learn,
Learn
and
as
my
well. And my
viewers want to
viewers
learn
want to
as
learn
well.
as well. We have a lot of medications, hormones, commonly some of those pills that will help regularize their periods. You also have those that have heavy period that you might want to give some drugs to help reduce um the flow,
So
to
okay.
reduce that.
Oh, wow.
But there are also people that you have to take to the theater to take out some growths and some
Wow.
abnormalities. So it's a whole lot. Some you have to give them something to shut down the ovaries for a short while for them to feel better, less pain, and all of that. So
Yes.
it's just a range of things that can be offered to the client. So depending on the cause of your irregular periods, you can be offered care at every point in time. For most causes of irregular period, there is a cure. So
Okay.
there's nothing to worry about.
So we're happy to hear that there's a cure for it.
Yes.
Okay. So when I was
Or
growing up,
will I say management? I think better word. There's something
management.
management. Yeah.
Okay, okay. So when I was growing up, when I was like 18, and then we used to talk about taking sugar, any sweet thing close to your period will cause you, heavy period, pains, and all that. So I don't know, does it have a link, like taking anything sweet, like sugar and all that? Even milk, I heard that milk too. So I
Well,
don't know.
well, from my own point of as a professional,
Yes, ma'am.
um, we speak based on research
Okay.
or
Oh,
facts,
yeah.
so we don't go with anecdotes. So for me, I've heard that too. Everybody heard that too. They say
Okay.
they take sugar and the period is heavy.
Yes.
But from a practical point of view, I don't think that doesn't work for me
Okay.
and some other women I've interacted with.
Okay.
But probably it's somewhere that maybe we should look into. But I
Yeah,
don't.
maybe we
I've
should
not seen a
research.
paper on that.
Okay.
Yes.
Okay. So also there's another one about taking pain relief during your period. Some people say no, don't take it. It will stop it from coming. All sort of things. So I don't know. Does really when you take pain relief like diclo, that's the common one, and then feldine, that's the common one that we take. So I don't know. I
Yeah,
want to
brand
know.
ambassador.
Yes, I'm a brand ambassador for that. So I want to know. Does really taking that, does it really affect the period? Some people say it doesn't even come. Some people say it will cease and then come again. So I don't know. Does it have any
Again,
effect on it?
those are just myths that I would
Okay.
say.
Oh, okay.
So whenever you have pain and you
Okay.
have means of treating your pain,
Yes.
please do take pain meds. Most importantly, when some people might have reservation with taking what you just mentioned,
Yes.
the drugs you mentioned, they are called NSAIDs, and those are a group of drugs. So some persons will say if you take it middle of your cycle, because some women also have pain middle of their cycle,
Yes.
it might affect ovulation. So some
Okay.
people will discourage taking that if you're trying to conceive. But when it comes to, but at the time when you're supposed to see your period and you're having pain, any pain med that would help take care of your pain is welcome.
Okay. So another one is I wanted to know, you talk about lifestyle earlier, right? So I wanted to know if there are some, lifestyle modifications that someone can actually do that will help to, make their period regular like
Yes,
that.
there are a lot. Like commonly, like this polycystic ovary. So why I keep referring to it is the commonest cause of
Okay.
menstrual irregularity, and you see a lot of young women trying to conceive with that. He said that just as small as 5% weight loss in them can improve
Okay.
ovulation.
Wow.
So you see that weight loss as a lifestyle modification is already helping. It's something that should be
Yes.
practiced.
Okay.
Yes. Then those that have eating
Oh,
disorders like, yes, there are some eating disorders. Some young girls just think they are too big, so they
okay.
don't even want to eat. So
They
seeking
stop
weight loss, so
eating.
they need counseling and all of that. Those
Wow.
might help. Those are some lifestyles. So when they come back to their normal feeding habit,
Yes.
exercising, lots of rest, transfer things that are not emergency and get some rest, reduce your stressors and all of that. That
Yes.
would go a long way.
I think people
So,
are going into the exercise more because there are a lot of people now, and even some celebrities now are losing weight. Like you see them today, they are looking like this, tomorrow they are like that. And then they always talk about hormonal imbalance, PCOS, and all that. So I think maybe that's the reason why they want their period to be regular, and maybe.
well, they all have their reasons.
So you said exercise can actually help, right?
Yes.
So my girl is, please go and do some exercise.
Dust your
Yes,
shoes.
yes, please register that gym today. We're in May already, and you said you were going to do it January, and then we're in May already. So
So,
please go and register that gym. It's not that expensive. Make sure that you're fine. And your periods are regular. Okay. So what are the potential long term health consequences of untreated irregular period?
well, so when people have irregular periods, commonly they don't menstruate frequently. Yes, for those that menstruate too frequently, it might not be, this might not be applicable to them. But
Mm-hmm.
when you don't menstruate, what happens is that the lining of your womb builds up. So for
Okay.
some people, long term, they can have some form of abnormal, some things in the uterus,
Wow.
some, well, even though infertility is the commonest with irregular period, long term when you don't manage it, but some people can go ahead to have endometrial or things on lining of the womb, challenges there, bleeding and all
Wow.
of that that needs to be evaluated. Sometimes they call them maybe some things before cancer, pre-cancer lesions and all of that,
Wow.
and even cancers.
Even
Yes,
cancers.
yes. So with that. So common is infertility anyway. Most
Okay.
people, once you don't treat infertility, is one of the
Infertility.
things, because once you cannot track your period, you
Yes.
cannot track ovulation. It
Okay.
means that you keep trying at the wrong time.
Okay. So my viewers have heard you, and I'm sure that everybody that is listening is learning a lot or has learned a lot today from irregular periods. So if you have any irregular period, please come and see us at House Hospital. We'll give you the best care. And if you cannot come, please see your fertility specialist. Okay. So ma, what more do you have to add for us about irregular period?
Well, generally, understanding your menstrual cycle is another way of a form of general healthcare. And I want our viewer to know that she is not alone in whatever
Um,
challenge she's having.
yes, ma.
And what she assumes as irregular period might just be regular if she listens and interacts with her gynecologist. So just one stop to your gynecologist might make a whole lot of difference, improve quality of life, improve fertility rates, and she's the best for it.
Oh, thank you so much, ma. So, guys, if you are in Jos, wherever you are in the world, please come to Alps. If you want to see this amazing woman, please come to Alps and come and see her. She gives the best and quality care, guys, and she's very soft and gentle. I myself have had a personal encounter with her, and guys, she's doing well. So please come to Alps for every kind of checkup, everything about the woman. We do it at Alps, right?
Yeah.
All right, and she'll be there to see you, and so many other gynecologists as well. So we'd love to have you when you have any problem at Alps Hospital. So thank you so much for staying glued to your screen to watch us. Make sure you like, comment, and still share with your friends and families. So we'll do this again next Friday. Stay tuned. Thank you, guys.
Bye.